Hello. Happy Sunday. Happy Sunday and happy Easter to all who celebrate. Of course, it's also Passover for our Jewish friends. And so for those of you who've been celebrating Passover, happy Passover. Guys, I am excited. It's Sunday. I already had a huge breakfast and I have a special brunch prepared for myself. That's right. Dr. Cindy cooked. I actually know how to cook. I grew up with a mother who had a restaurant, so I learned to cook, but I prefer to be treated to a meal on Easter. However, with the whole physical distancing bit, I am left having to feed myself. Anywho, today I'm so excited because I am going to be joined by my friend and colleague, Dr. Kelly Wood. Dr. Kelly is based in Atlanta. She is a board-certified internal medicine doctor and a medical endocrinologist. That's right. She did a fellowship in medical endocrinology, which means that she knows how to take care of any hormonal disorder in patients of all ages. And that includes the most common hormonal disorders like, diabetes, thyroid issues, prolactin problems, growth hormone issues, you name it, Dr. Kelly knows how to treat it. Now, I have a special affinity for medical endocrinologists because I myself am a reproductive endocrinologist. And so some of the work that I do overlaps with specialists like Dr. Kelly. And so without further ado, please join me in welcoming Dr. Kelly. Hey,
hello. I am representing my beautiful country of Barbados.
Welcome, Barbados in the house.
Thank you for having me, Dr. Cindy.
Well, we are so excited to have you. I'm so happy that you could make the time today on Easter Sunday to join us. And you're based in Atlanta. How are things in Atlanta today, Doc?
Things are gloomy. It's raining. It was thundering just now. So if the internet connection runs out, don't leave. I'll come back. Okay.
Okay, wonderful. And same goes for me. If I drop off, I will be back. Now, I know we have a lot of people joining us. They're joining us from Facebook, Twitter / Periscope, and YouTube. And so, hi, everybody. Hi. If you have questions for us, please just put them in the comments wherever you are. I will get to them and we will answer them. If you have comments, we welcome them as well. Dr. Kelly, I know I messaged you some questions because I'm so eager to really jump right into it. But of course, another reason why I wanted to talk about what you do today is because the numbers that are coming out across the United States, especially, show a huge disparity when it comes to the people who are being most severely affected by COVID-19, which is the disease caused by infection with coronavirus. And we're especially seeing that people with underlying diabetes, people with underlying hypertension, people with underlying heart disease are especially becoming the sickest and the ones most likely to die from COVID-19. And I couldn't help but wonder if some of this has to do with just how one is managing their diabetes, how people are approaching even their pre-diabetes, and whether or not it's even clear to people what the distinction is between the two. And so this is why I wanted to bring you on. The other is because we know, as we're both women of color, we're both Black, both Afro-Caribbean women. Dr. Kelly showed you Barbados, Rihanna's home country. That's right, for Dr. Kelly. And as you know, I'm from Trinidad and Tobago, specifically born and raised on the tiny island of Tobago, which is pretty close to Barbados, actually, in terms of geography and heritage. And so I really thought, you know what, this is a good time to talk about this because there's so many overlaps in terms of subject matter here. We're talking about COVID-19. We're talking about diabetes being a big risk factor for severe complications and fatality, dying from COVID-19. And take all three of those and you couple it with the fact that what we're seeing now is there's a higher rate of people of color dying, and probably it's because of this underlying disease.
Yes, it is. So, initial data coming out of China showed that the overall death rate was about 2 to 2.3%. But then when we broke it down according to comorbidities, if you had diabetes, your risk of death went up to like 6 point something percent. Same thing for heart disease as well as for hypertension. And then even looking closer here in Louisiana, I think I read an article on Monday that said out of the people who died, 66% had hypertension and about 41 or 42% had diabetes. So I'm still seeing patients. I'm doing it, by video or telephone calls, and I'm impressing upon all of my patients with diabetes. Now is the time for you to really take better care of your blood sugars. So having diabetes doesn't increase your risk of contracting COVID-19. But if you do have diabetes and you do become sick with coronavirus, as Dr. Cindy said, you have a higher risk of having a severe complication from it and even dying from it.
And that's what's so scary. I speak even as someone who has very close family members who are diabetic. So this particular topic hits close to home for me, and I suspect for the vast majority of people in the audience. So just to explain to everybody first and foremost, what is diabetes? How is it diagnosed? What is diabetes?
So diabetes is when you have a disorder with your glucose metabolism. Your body doesn't process sugar well. So our cells use sugar as the main form of energy. And there's a hormone called insulin that's made by the pancreas. And the role of insulin is to get the sugar from your bloodstream into your cells where it's used for energy.
Yeah.
In patients who have diabetes, there are two main types of diabetes. We'll go over that. But for type 2 diabetes, your body is making insulin, but it's just not working well enough. It's like insulin is trying to turn the key, but it's not working.
Yeah.
So the sugar can't go into your cells, so it builds up in the bloodstream.
Yes.
Currently, there are over 30 million Americans who have diabetes. And 1 in 3 Americans, so 88 million Americans, have prediabetes. And the majority of those don't even know that they have prediabetes.
So you're telling me that between prediabetes and diabetes, 120 plus million people, 118 plus million people have either prediabetes or diabetes in the United States. That's a third of the population.
Yes.
That is amazing. Guys, this is why we had to have Dr. Kelly on today. And of course, Dr. Kelly, I like to keep an eye toward the Caribbean as well and global diaspora. Do you know what the numbers are in the Caribbean, for example?
I'm not 100% sure. I know where I'm from in Barbados. It's like the diabetes central of the Caribbean. I did my medical schools there. I did my internship there and a year in internal medicine there. And we saw lots of different complications, whether it be lower limb amputations, blindness from diabetic retinopathy. So I know this problem is very prevalent in the Caribbean.
Yes. And, from one of the studies that I saw from the Pan American Health Organization, this was one of the reports about 3 years ago. And they said that people were diabetics who were in the Caribbean were 6 times more likely to die from their complications of their diabetes compared to people in other parts of the world, showing again that diabetes is really prominent, and also showing that 12 times as likely to have heart disease as people in other countries. And so all very important information to be mindful of.
Yeah, even here in the United States, when you compare Black people who have diabetes as opposed to white patients with diabetes, Black people have a 3 to 4 higher risk of having kidney failure, having heart disease, and even death from diabetes. So there's still that healthcare disparity here when it comes to management of diabetes.
Which then means if you have people with these high disparities who have these underlying disorders who get infected with coronavirus, it could also help explain a lot of what we're seeing in the huge disparate numbers that are now coming forward in terms of outcomes of COVID-19 in these patients, and specifically populations where the vast majority are Black people. Yes,
I was looking at some data recently, and it showed that Chicago, the population is 30% Black, but 70% of the deaths in Chicago were from, people of color. And why is that? I think it's multifactorial, so many different reasons. Food deserts in the inner city, not having access to healthier options. Also affordable and accessible healthcare. I know for my patients who have diabetes, sometimes their supply of insulin for 1 month is $300.
Yes.
Copay for that.
It's expensive.
Yes, it's very expensive. And I've had discussions with patients about, well, I had to ration it and make it stretch over the month. Or doc, I'm on a fixed income. I have to eat. I have to choose between being on insulin and eating. So a lot of these patients, even before coronavirus happened, they were like sitting ducks waiting for an infection to take them out.
Yes. And that's the thing I think most people don't understand is diabetes does increase your risk for a lot of underlying other problems. So infection, if you were to become infected with poorly controlled sugars, the infection can really progress very quickly. Poorly controlled sugars impairs your immune system. So your immune system just doesn't work as well as it would if your sugars were well controlled. We happen to know that people in intensive care unit, if their blood sugars aren't tightly controlled while they're on a ventilator, etc., they're less likely to wake up, less likely to survive their intubation and intensive care unit admission.
Yes, you're correct. Yes.
Yeah. And so for the person listening right now who is saying, okay, so pre-diabetes, diabetes, she still didn't tell me how we diagnose it. How do we diagnose it, doc?
Okay, so there are three main ways to diagnose diabetes. There's a test called hemoglobin A1C. It looks at the amount of sugar that's on your red blood cells. It's a test that we perform every 3 months. So it gives us a 3-month working average about what your blood sugars look like. And a normal A1C is when you are 5.6% or lower. Mm-hmm. To be diagnosed as having diabetes, your number has to be 6.5% or higher. Anything between 5.7% and 6.4% is pre-diabetes. Pre-diabetes means your blood sugars aren't normal, but they're not high enough that you could be classified as having diabetes. So that's the A1C. The second thing that we can do is to do a random blood sugar at any time of the day. A random blood sugar over 200 milligrams per deciliter, that's in the diabetes range. To get it into millimoles per liter, which most of our Caribbean countries use, you divide by 18 to get that number.
So repeat that again. What do you do? What's the factor?
Divide it by 18.
Divide by 18. Okay.
Yes. But my mind is already swapped to this.
So you're saying if somebody has like 600 millimoles per milliliter, divided by 18 to figure out if it's above 200 milligrams per deciliter?
So if the one has 600 milligrams per deciliter, divide that by 18 to get the millimole per liter.
Oh, okay. Guys, see that? So the factor matters. Okay.
Right.
And so we've talked about A1C.
Random blood sugar.
What is random? Because most people seem to think, you have to be fasting for 12 hours is the only way to know if you're diabetic. What does random mean?
At any time of the day.
Yeah. So even if they have just eaten.
Yes.
Yeah.
So if you look at fasting blood sugars for diagnosis, we consider fasting when you haven't had anything to eat besides water for at least 8 hours overnight. And a normal number is when you're less than 100. So 99 and lower is normal. To have diabetes, your number has to be 125 milligrams per deciliter or higher. So anything between 100 and 124, we consider that to be pre-diabetes. And then the last test that a lot of us really don't do anymore is postprandial blood sugars, where we bring you into the office and we give you a sugary drink that has about 75 grams of sugar in it. And then we check your blood sugars 2 hours later. Yeah. So a normal number is when you're less than 140 milligrams per deciliter. So if I don't have diabetes. If I ate a meal and check my blood sugar 2 to 3 hours later, it should be under 140. If you have diabetes, that number is going to be above 200. So anything between 140 and 200, we consider that impaired fasting glucose or pre-diabetes.
Yeah. So impaired means the body isn't breaking down. It's not using sugar the way it's supposed to, correct?
Yes.
And so does pre-diabetes mean that someone is on their way to diabetes?
Definitely. Pre-diabetes is one of the number one risk factors for you to develop into full-blown diabetes, but it doesn't have to be that way.
Right. And we'll talk about that, won't we?
Sorry?
I said we'll be talking about why it doesn't have to be that way. Yes. And, it's important, I think, that people hear that, because I can't tell you how many patients I've met who tell me I'm just pre-diabetic, and they seem to think that in itself is enough, and we don't need to talk about it any further. But prediabetes, you just said 88 million Americans, 88 million Americans have prediabetes.
And the majority don't even know that they have prediabetes.
That is astounding. That is astounding. And it's good. It's good to know that we need to talk about this, guys, because you know what? There are not 88 million Black people in America, which means it's not just a disease of Black people.
Right.
So who are the people who seem to be at risk for developing prediabetes and ultimately diabetic? Because the truth is, every diabetic was, except for type 1, every type 2 diabetic was probably a pre-diabetic at some point.
Definitely. I mean, I have some patients who come in who might have had surgery or some other issue going on, and they find out they have diabetes because they were in a hospital and someone was checking their blood sugars. So a lot of us don't even know what's going on with our own bodies. So in terms of the risk factors for prediabetes or diabetes, age is a big one. So anyone over the age of 45 should really be screened for diabetes.
How often?
I would say at least once a year with their annual physical. Yeah.
Okay.
If you have a family history of type 2 diabetes, you are at a very high risk. If one parent has diabetes, you have a 25% chance, which means a 1 in 4 chance of getting diabetes. If both your mother and your father have it, you have a 1 in 2 chance. So 50% chance of getting diabetes. So genetics is super important. Obesity, being overweight or obese will increase your risk. We talked about insulin earlier.
Yes.
So one of the reasons why insulin doesn't work is called insulin resistance. And obesity or being overweight is what leads to that insulin resistance. That's a big risk factor. Being sedentary, not exercising, your diet, if your diet, all the white stuff, white bread, flour stuff, sweets. I tell my patients, I have it in my head, crackers, pretzels, potato chips, all the pasta, rice, bread, all those tasty things that make us feel happy.
Yes.
Those are the things that are going to really raise your blood sugars. And also diabetes is also linked to other coexisting conditions like hypertension, high cholesterol. They kind of cluster in one individual. That's why these people who are dying, I am sure that they just don't have diabetes. They probably have diabetes as well as hypertension, as well as obesity.
Yes, as well as heart disease, because a lot of people don't realize that diabetes and heart disease go together.
Yes. Heart disease is one of the number one ways that people who have diabetes die. They have massive heart attacks. Yeah.
Yes. And I think a lot of people don't realize that. And so, unfortunately, there's so many conspiracy theories circulating right now as well as it relates to COVID-19 and cause of death. And, people don't understand how cause of death is determined, that there's a lot of misinformation and thus misreporting of cause of death as it relates to COVID-19. But yes, somebody with diabetes who has COVID-19 can die from a heart attack in the hospital. And that is, in fact, what is happening. A lot of people with COVID-19, the ultimate thing that causes their death is heart failure, cardiac arrest. So it's important to know that, guys. It's also important to know that the number one cause of death across the world in men and women is heart disease. But you can have heart disease and also have diabetes. You can have heart disease and also have high blood pressure. So Dr. Kelly, given that, if someone is sitting right now listening to this and they're like, yeah, I'm healthy, but mom and dad have diabetes, should they wait till they're 45 to get checked?
Most primary care doctors would be willing to add an A1C in. Yes. The guideline says over 45, you have a higher risk. We also do once a year, some physicians also check a complete metabolic panel. And they ask you to do it fasting, and included in that panel is a fasting blood sugar. So that's a good way to see where you're at. So if you know that both of your parents had diabetes, like I said, you have a 1 in 2 chance of also getting diabetes. But there's some things that you can do before that happens. Yes. We recommend that you have at least 150 minutes of exercise every week. That's like half an hour, 5 days a week at a minimum. That's for everyone, family history or not. Everyone needs to be moving. I know it's a little bit harder now with the whole social distancing, but go to a park and still maintain that 6 feet distance. You can put something on your TV or on a computer and just stay active. Also, watching what you're eating, cutting down the amount of carbohydrates in your diet. I know as Caribbean people, we like our sugar cakes and our sweet bread, coconut bread, and all of that stuff. And I tell my patients, we need to be realistic. I don't want people are trying different diets like keto diet and paleo diet. And, I'm all for a healthy diet that you can maintain. Yes. A lot of people go on these crash diets, and then when they stop, they gain everything back plus more. Right. So I'm realistic. I'm not telling you can never have a slice of coconut bread ever again in your entire life, but don't have one every single night. Right. Is what I usually tell my patients. So main things would be, exercise, diet, maintaining a healthy weight. If you do have high blood pressure, also working on cutting down the amount of salt in your food, watching your cholesterol as well, because those usually cluster. Cholesterol, blood pressure, and diabetes cluster in the same individual. So reducing all of those risk factors.
Right. And, speaking of risk factors, given as a reproductive endocrinologist, there's one other key group of young patients who are increased risk for prediabetes and diabetes, and that's women with polycystic ovarian syndrome, or PCOS. Mm-hmm. And for a lot of young women with PCOS, they've never been told about the things that don't relate to infertility, because for most young women, they find out about PCOS in the course of trying to conceive. And then once they've had their babies, they believe their PCOS issue is no longer a function. But the truth is, PCOS is one of the groups we really want to know about when we're thinking about long-term risk reduction for diabetes, cholesterol, and high blood pressure, no?
Yes. I mean, the majority of patients that I see with PCOS are overweight or obese. In terms of why this happens, there's different theories around this, but part of the whole disease process is insulin resistance.
Exactly.
So it all goes back to what we talk about. So a lot of my patients who I treat for this condition, I have them on metformin. Mm-hmm. Metformin can sometimes bring the periods back. If they also have coexisting issues with blood sugars, it helps to reduce their blood sugars as well. A lot of these patients have acanthosis nigricans.
Yes.
So people say, oh, the back of my neck is dirty. I thought it was the soap. I was like, no, it's not the soap. Yes. That's a clinical sign that you have insulin resistance.
Yes. And let's talk about that, because acanthosis nigricans is a term that I see circulating on a lot of social media posts, which on the one hand, I'm really excited to see, because it means people are aware of it, but I also then see it associated with some misinformation, right? So acanthosis nigricans, for those who are listening, is that sort of darkening that you see on the back of the neck. It almost looks like it's an accumulation of dirt or miscoloration.
It's also leathery, a little bit
leathery and velvety looking. And so a lot of people have acanthosis nigricans, and they're hearing one thing or another, and they're actually being told, you know what, if you have that, just go ahead and use some herbs. I've seen quite a few herbal posts, which is go ahead and drink some celery, drink some cinnamon, eat more okra, drink soursop leaves. And I know I'm going down the list because I've received them all, or I've actually had my own family members who, sent me these and saying, Cindy, you're missing out on key information. And so I appreciate everyone sending me. I would say this, particularly in communities of color, okra is a huge part of our diet, and it's been a part of our diet forever. If that was all that was needed to cure diabetes or to prevent prediabetes, people in the Southern Caribbean, West Africa, and the Southern United States would actually have lower rates of diabetes, not higher.
Agreed with you.
Yeah. I think it's unfortunate that somehow that got lost in the messaging.
Yes. I'd never heard about the okra, so thank you for educating me today. I've heard about cinnamon before. There's some other stuff that Dr. Oz had on his show. I forgot what it's called, moringa. Moringa.
So it's chromium. I like to tell patients, listen, like I mentioned earlier to Dr. Kelly once when we were talking, I have 10 packs of frozen okra in my freezer. I'm not here to tell you don't eat okra. We're both from the Southern Caribbean. We appreciate a good callaloo, which has okra in it. We appreciate it. We know it. But I also will be doing you a disservice, and I will both be doing a disservice to the oath that we took to do no harm. If we told you today that okra was going to solve your prediabetes or your diabetes, you can eat your okra, absolutely, but don't do it instead of exercise. Don't do it instead of medications. Don't do it instead of a healthy diet. Right, Dr. Kelly?
Definitely. I mean, okra is great for you. I'm not saying not to have it, but have that as part of a healthy diet. I have patients who, stop their own medication without even consulting their physicians because they're trying more cinnamon or they're adjusting their stuff. Like, please don't do that, especially not now.
Yeah.
Any changes you make in your medicines, please run it by your physician.
Speaking of cinnamon, when I was in fellowship, we actually had someone who came in and showed us how much cinnamon you need to take per day to be the equivalent to 1 tablet of metformin. Mind you, most people need to be on 2 to 4 tablets of metformin a day. And it was a whole cup full of cinnamon. Can you imagine what that would taste like if you had not a water flavored with cinnamon? I mean, a cup full of cinnamon powder like this. That's how much you would need to start being equivalent to 1 tablet of, say, metformin or glucophage, a 500 milligram tablet. And I think it's important that people hear this because, again, I love my cinnamon. We put cinnamon in so many things, our tarts, our puddings, our right, the sweet breads and the sugar cakes that Dr. Kelly just referred to. Cinnamon is in all of that, but you wouldn't possibly be able to eat or drink enough cinnamon, even if it were made into a tablet, to be healthy and safe enough to bring your blood sugars down. So moringa is another one. Moringa is an interesting herb because it's now become the herb to treat all things, the magic herb. And again, we have moringa plants on my veranda, on my porch. I have a moringa plant. The truth is, if moringa lowers blood, maybe it lowers it 5 points or so. But when we talk about hypertension, what are we talking about, Dr. Kelly? When we tell somebody they have high blood pressure, what are you talking about?
So some people say I have a little bit of pressure.
A little bit of sugar.
A little bit of sugar. There's no such thing, a little bit of pressure, a little bit of sugar. So I believe it's when your blood sugar is over. Well, when you have diabetes, our goal is for you to be under 140 over 90. Yes. But a hypertension, anything higher than 120 over 80, you consider to be hypertensive. Yes.
And so that's important too, because I think a lot of people think high blood pressure is when your blood pressures are 180, 200, right? As long as under 100, you're okay. But the truth is, it has a lot more nuance. And like you're saying, the bottom number needs to be under 80 or under, ideally.
Yes.
And the top number needs to be 120 or under, ideally.
Yes.
So if you're somebody with a number definitely above 130 for your top number, you should be talking to your doctor. And especially if your bottom number is 90 or higher, you should be talking to your doctor, correct?
Correct. Yes. So, I mean, as a diabetes specialist, those are the things that I look at when I see a patient, even though their primary care might be managing their blood pressure, it's still part of the questions that we go through just to make sure, because diabetes is a risk factor for heart disease. So is hypertension, so is high cholesterol. So we have to make sure that we're treating all of these conditions in the patients.
Yes. And, Dr. Kelly, I'm glad you brought that up because you're really referring to what we call the holistic patient approach. And unfortunately, a lot of patients don't realize that medical doctors do holistic treatments and approaches. But especially as a hormone specialist, an endocrinologist, that is important because hormones are in every part of the body. And so every part of your body can be impacted by your hormone imbalance.
Definitely. Even something like smoking, I could get someone's A1C under 7%. That's the goal when you have diabetes, by the way. But if they're still smoking, they still have a very high risk of having heart disease. So we ask those questions at each and every visit. Are you still smoking? Do you want me to refer you to somewhere so we can work to help you to get off the cigarettes? And even though with coronavirus, I saw a recent article thinking that vaping and smoking, even weed, increase your risk of having, complications from coronavirus.
Absolutely. And, it makes sense that it would, but that's why I'm glad we're talking about this today, because I think a lot of patients and people listening don't realize how these things go together, right? If you have diabetes, your doctor still has to look at your blood pressure and manage it with you. They still have to look at your kidney function, your liver function. They're still asking about your eyes with good. And especially if you're pregnant, all these things go together. And so if you're a pregnant diabetic or a diabetic who's planning pregnancy, I could see that a couple of my pre-diabetic and diabetic patients are on today. They know, right? Dr. Cindy doesn't play. If you're planning pregnancy and your hemoglobin A1C is above 6.2, we're talking about it for sure. If it's above 6.5, meaning you're diabetic, Dr. Cindy is sending you to see a heart doctor. She's sending you to see the high-risk obstetrician. She's sending you to start monitoring your blood sugars and emailing it to her office every week, monitoring your blood pressures, emailing it to my office every week, because we have to start planning even before you're pregnant, because this can actually have tremendously negative impacts on a pregnancy.
Yes, and even when someone becomes pregnant, our criteria for like optimal blood sugars is a lot stricter.
Yes, and why is that? Why do we care about blood sugar in a pregnant woman?
So, having uncontrolled diabetes in pregnancy a lot of different things. It will increase your risk of having first trimester miscarriages.
Yes.
It increases the risk of having preeclampsia, increases the risk of having fetal malformations. Later in the pregnancy, there's a risk of fetal macrosomia, meaning that you're going to have, those big 9 to 11, 12 pound babies.
Yeah.
And also the high levels of insulin can cross the placenta and lead to fetal hypoglycemia as well. So there's some different things that we have to watch in pregnancy. I have some patients with diabetes who don't plan to get pregnant, but they happen to get pregnant with an A1C of 10 or 11. I have seen that. And sometimes they don't have good outcomes. But with my patients, they have to email me every Tuesday and Thursday, so twice a week, with their blood sugars. And we're a little bit more aggressive with getting their blood sugars to goal. I try to get them close between like 6 and 6.5 when they're between 6 to 6.5 when they're pregnant. And I find that women are a little bit more willing to compliant when they're pregnant.
Absolutely. And that's what I do. And so, I have patients for whom, so they show up and they're doing in vitro, for example, IVF. So we don't delay their IVF in the sense that I'll go ahead, we'll take the eggs, we'll create the embryos if we have sperm, we'll freeze them. But they also understand right away that Dr. Cindy is expecting, once your embryos are safely frozen, that you're now going to go ahead and work really hard on getting your blood sugars under control. You're going to go ahead and work on getting your blood pressure under control. Because, the goal here, guys, the reason why we're talking about this is healthy mom, healthy baby. And yes, like Dr. Kelly said, if your blood sugars are persistently high, meaning A1C above 7, especially if you've got A1C above 8, 9, or 10, you are up to 6 times more likely some miscarriage, up to 10 times more likely if your A1C is above 10 for miscarriage and stillbirth. And so if you're someone here reading, listening, watching, and you're like, I have blood sugar problems, but I didn't realize it could have led to my miscarriage. It could have led to my stillborn baby. Yes. So we're going to talk more about those things. We have a lot of questions, Dr. Kelly, so I feel like we'll answer more questions and talk some more as we go through the questions and comments, because there's so many. And so, hi, Yosemi. Hello. Happy Easter. Happy Easter. Yeah. You go, doctor. That's the way to. Thank you. I don't know if it's for me or Dr. But thank you. So, Joanne, happy Easter Sunday. Blessings to you, Dr. Duke. Happy Easter, Curtis. Happy Easter, Doc. Lloyd Brown says hello. Hello, Dr. Brown. Joanne says hello. Good afternoon, Dr. Kelly. Happy Easter. Colin says, great stuff. Dr. Renee says, good afternoon, ladies.
Hi, Dr. Renee.
How are you doing there in Chicago? Staying safe, I hope. Debbie, Trinidad and Tobago, saying hello to Cindy. Happy Easter, and to Dr. Kelly from Barbados. All right, so we're coming down to the questions. So Aloy says, thank you so much, Dr. Cindy, for the info and, of course, representing a big way. Big up. We're both representing. We're excited. Dr. Brown is saying astounding. I suspect that's in reference to that astounding statistic that you shared with us, Dr. Kelly, which is that 88 million diabetics in the United States. And did you say 33 million diabetics?
Over 30, yeah. Million, yeah.
Over 30. So that's over 120, wow, almost 120 million people in the United States have sugar problems. That's important to know. Good evening. Ethel says, my A1C is 7. Is that high?
So if you are not on any medication, yes, I would say that you would probably need to start something to bring that down. However, if you are diabetic and you're on medication, technically the goal is to be under 7%.
Yes, yes. I have Zelda. Zelda says, talk about 49.6% obesity in Black Americans and 13.8% severe obesity.
So that is one of the reasons why we have all of these comorbidities. It starts with being obese or overweight, the hypertension, the diabetes, the high cholesterol. And, like I said, these disparities happened before coronavirus. And as Dr. Fauci was saying, this is just shedding a light on what was existing before. I think we all have to have a discussion of what can we do moving forward for these at-risk communities. I don't think it's a simple answer. Obviously, like we're talking about earlier, affordable healthcare, affordable insulin, medications, more education. When this whole thing started with coronavirus, we were hearing that Black people don't get coronavirus. Even about how to treat your blood sugars, how to treat your high blood pressure. We need more education in Black communities. Food deserts. How are we going to get healthier options in?
Yes.
Not
and
sure what
desert, what Dr. Kelly is referring to when she says food desert is that in a lot of communities, particularly inner city communities, there are no groceries, no fresh food supplies readily available unless they leave their neighborhoods and go to the suburbs, etc. Many people won't find food, nutritious food. They may have the corner store, etc., that will have a lot of processed foods. I know a lot of corner stores, not to knock on them, because they're the only source of food in many neighborhoods. Many of them have now started trying to incorporate more healthy food options. But nonetheless, that's what food deserts are, it's an inability to readily access nutritious, balanced food items.
And a lot of us, I think, generationally, we pick up the habits of our parents and our grandparents.
Yes.
So if you as a child don't really see your parent exercise or go running or whatever, more than likely it's not going to be part of your lifestyle.
Right.
Even as Caribbean women, the kind of things that we eat when we gather together, like the rice and peas and the macaroni pie and the corn pie and all the high carb things. Yes. So I think, and nowadays you have children who are already diabetic, like before the age of 11.
Yes.
Some children already have diabetes. So I think we also need to look at childhood obesity as well.
Very much so. And speaking of childhood, so we kind of referenced it earlier. There's type 1 and there's type 2 diabetes. And what you're actually speaking to in terms of the alarming thing that we're seeing is type 2 diabetes, which used to be called adult onset diabetes. We're now seeing type 2 in children. Yes,
it's sad. So to put it simply, type 1 diabetes is an autoimmune condition where your immune system attacks your pancreas that makes insulin. So you can look for those antibodies in children and adolescents, and they have antibodies that attack the pancreas.
Yeah.
It's genetic. It's actually not as strongly linked to your genes as type 2, though.
Yeah.
With type 1 diabetes, there's no cure for type 1 or even type 2. We can talk about that as well.
Yes.
But for type 1 diabetes,
research, and we definitely want people to support the research because we will get there. We will find a way to solve it, but not yet. Go ahead, though. Sorry.
No problem. So for type 1 diabetes, you can't fix it by eating better or exercising. Your body just doesn't make insulin, and the treatment of choice is insulin.
Yes.
In type 2 diabetes, however, your body makes a lot of insulin, actually too much insulin. But because of insulin resistance, you can't process the sugar well, so your blood sugars also rise. Type 2 diabetes, you can reverse it or control it by weight loss, by diet, by exercise.
Yeah.
It can go into remission.
And I get a lot of people who ask that because, diabetes comes with so much taboo, right? For a lot of people, unfortunately, they feel like diabetes is an insult to their existence and their lifestyle. For many, diabetes is because in their mind it's associated with poor diet, with overeating, with weight issues, that for many people, diabetes is a shameful thing to admit. And so they'd rather either live in denial, or the only way they're going to work on it is if you tell them they can reverse it, right? They can. Yeah. And the truth is, there is some evidence that some people have been able to reverse diabetes. But to be clear, the disease process, if it's caused damage to your heart, etc., that's happened. But you might be able to reverse the issues of how your body uses sugar if you lost weight.
Certainly. Even people who have like bariatric surgery and lose like a big amount of weight, they can also reverse or go into remission when it comes to their diabetes.
Yes. But notice the words that Dr. Kelly just used, guys. She said reverse or remission. She didn't say cure. And that's because diabetes is a multifactorial disease process that is, although the way we follow it, the way we measure it primarily involves looking at blood sugars, it's not the only thing that's happening. It causes damage to kidneys. It causes damage to the heart, to the blood vessels in your brain, etc. So even if you had massive weight loss, which we commend if you're able to do it or have surgery, it doesn't mean that your kidneys will suddenly be restored to their usual function. It doesn't mean that your heart vessels are now perfectly fine, or that you can now start eating any and everything again because you've done this.
So what we found is that if we are aggressive in treating diabetes within the first year of being diagnosed, you have a greater chance of it being in remission. Something called metabolic memory, where like Dr. Cindy said, after a year or two, like your blood vessels is already what we call endothelial dysfunction. The lining of the blood vessels are already damaged. When someone has diabetes, they also have abnormal cholesterol levels. They have low levels of the good cholesterol called HDL. They also have high triglycerides. Diabetes also affects the size of the bad cholesterol called LDL, and that predisposes to atherosclerosis. That's why diabetics have heart disease.
Yes, because it gets stuck. That bad cholesterol, LDL, because the size increases also, and the blood vessels are getting injured from what we call an inflammatory process. It then starts depositing or collecting sludge, so to speak, in the vessels. Mm-hmm. Yeah. And it's important for everyone to hear this, because this is the stuff that you're not hearing when you see the memes, okay? This is the stuff you're not hearing. I love Dr. Oz. I think what he's done as an entrepreneur and a person in media is tremendous. But we also have to say that in media, we talk in sound bites. And so although Dr. Oz is a heart surgeon, so he knows what these blood vessels look like, he doesn't have a whole hour like Dr. Kelly and I have right now to talk only about diabetes and the physiology of diabetes. And that's why we're here. We're not here to beat up on anybody else, but to tell you there's more to it than meets the ear or the eye, which is, it's not just the blood sugar. In the beginning, yes, that's our focus, because if we can control that, the reason why we want to control your blood sugars is so we can address all of these other things that we're talking about here. That's what we're caring about when we talk to you about your blood sugar. It's not just because we're trying to give you a shameful disorder. It's not just so your pastor can tell you, don't claim it. We don't claim it today. Don't listen to that, okay? I've
heard that many times.
Yes, but you can't just say, I'm not going to claim diabetes. Diabetes is not the day. That's not the one you're not going to claim. If you're sitting with your family today, talking about Easter food and meals, maybe consider making an Easter resolution, okay? How healthy are we going to be as a family by next Easter? How healthy are we going to be about not just the blood sugar, but our kidneys, our heart, our brains, our eyes, right? And so that's what we're here talking about. So Dr. Brown says, please speak on metabolic syndrome, what it is and its relationship to diabetes, hypertension, etc. Do you want to define metabolic syndrome for them, Dr. Kelly?
Metabolic syndrome is a cluster of metabolic disorders. So it's when you have high blood sugar, so fasting blood sugar over 100 milligram per deciliter, high cholesterol, high blood pressure. These patients also have increased waist circumference. I believe it's 40 inches for men.
For men, yeah.
35 inches for women, yeah.
So guys, what Dr. Brown is bringing up is another risk factor, which is some people aren't diabetic by the classic standards that Dr. Kelly just described, meaning A1C will be under 6.5. Their fasting sugars manage to stay under, is it 140?
Fasting under 100.
Under 100. Because I very rarely look at fasting. That's why I'm going to ask Dr. Kelly to remind us. But what Dr. Brown is referring to is you may have a constellation of different things happening in your body that will still have the same impact that diabetes, frank diabetes, has on you. And so your primary care doctors are looking for it. Dr. Brown, by the way, is a transplant doctor. So this is the man who, if your kidneys fail, he has to then work on putting back a new kidney in you. He has to figure out how to help your liver survive the hit from these diseases. So this is something that's very much, I imagine, of importance to him too, and that's why he wants us to talk about it. Because yes, there's metabolic syndrome. A lot of PCOS patients have metabolic syndrome. I know for a lot of us, particularly those who come from other cultures where body type and body shape can differ, it sounds very weird to hear that doctors care about whether your waist is larger than 35 inches as a woman, but it's because it actually speaks to the amount of belly fat that you have. That's what we're talking about. And the wider your waist, usually it's widened because of increased belly fat. And let's be honest, as somebody who's over 40, I've seen the waist increase, and it's why I keep a measuring tape in my house. I like to sew as well, but it's because I literally measure my waist and my weight.
The change in hormones, especially not when you're postmenopausal, leads to that deposition. We have less testosterone, less estrogen around. So the body fat kind of deposits differently as we get older as women.
Yeah. Yes. And so that body fat can really impact things, and so it's important. Now we have a few other comments here. So good afternoon. Hello from the Cayman Islands. Hello. Talk about pro-inflammatory effects of obesity, diabetes, hypertension, and cytokine storm.
Let you handle that question.
Yes.
Virologist.
Yes. So pro-inflammatory effects, actually, Dr. Kelly and I were just talking about that, which is obesity, like she was describing, leads to a number of inflammatory things as they relate to cholesterol sludge and buildup in the vessels that can then lead to your inflammatory system trying to fix the damage that these abnormally high sugars, and there's another hormone known as leptin. I mean, we could do a whole other show just about the inflammation of diabetes and obesity because it's so impressive and it has impacts on diabetes, but other organ systems. Pregnancy, we now know how important that system is in pregnancy, preeclampsia, and of course in how, if you're a pregnant mom who's diabetic, even if you're what we call gestational diabetic, your child is then born with increased risk of developing diabetes later on in their life. There's so much we can talk about, but specifically cytokine storm. So what Zelda is referring to very briefly is what we're seeing is that whenever someone's been infected with coronavirus, and particularly in people who already have underlying inflammatory disorders, which includes just obesity is considered part of the inflammatory spectrum now, you can actually see a dysregulation of certain immune chemicals being released, a lot of them being released, when ideally you'd want lower numbers of them being released, like IL-6. And in turn, that leads to what we're seeing now, what seems to be worsening of COVID-19 and worse outcomes. So some of the clinical trials, for example, right now are focused on things that can inhibit IL-6, different inflammatory chemicals or cytokines known as interferons are being used and looked at to see if they can at least change the progression to severe disease. And that's why. Zelda, thank you for that question. That was good. Good day, doctors. Hi, Erica. I'm working my way down, guys. I know you have more questions. Zelda again. Why don't we like to talk about these issues? Why the sense of taboo? We cannot hide it. You know, Zelda, it's a good question. Why the taboo? I'm not sure. I think I can speak as someone who is a member of a family where almost everybody is diabetic. My own mother is diabetic. I myself, not diabetic yet, but I flirted with pre-diabetes and had to really start getting myself together. And that's starting in my 30s, but I've been aggressive about it. But I'm also aware that one day I may well become diabetic because the genetic risk factor is so high. And what I can tell you from my very large family, and to give you a sense of how large my family is, my maternal grandmother had 12 children. She died at age 52 from complications of diabetes, leaving her two youngest of 12 at 16. They've now gone on to develop diabetes, high blood pressure, other issues. That's my mom and her twin brother. Of her 12 children, all of them went on to develop some part of that spectrum of what Dr. Kelly and I have been talking about. Her oldest child also had 12 of her own children. And of her 12 children, every single one of them has been diabetic. Every single one of their kids, most of them have 4 to 8 kids. They also have diabetes. I have third, fourth cousins, my grandmother's great-great-grandkids who've now had stillbirths. They've had children who had pregnancy complications. I have relatives, first cousins who've died in their 40s, early 50s, all from complications related to different parts of diabetes, kidney failure, heart attack, stroke. It's prevalent, but even in my own family, despite all that, right? I know I'm taking on the family soapbox now because this is really how I get even with my family, is they tell me things like, no, I don't have diabetes. I don't have that. I eat healthy. I work out, for the ones who have sexual dysfunction, because many men with diabetes have erectile dysfunction from nerve damage. High blood sugar leads to damage to blood vessels. That can also lead to damage to nerves that can cause problems with erections. And so that's another part of the taboo. And so it's all these different things. I had one cousin who I was asking him about his diabetes, and to prove to me that his diabetes wasn't as bad as I was concerned for, because he had already lost his vision in one eye, which he blamed on an eye drop, but it wasn't. And he calls his wife and he says, "Tell Cindy how healthy I am. Tell her how the boy is working." That's a Caribbean thing, I know, but it's a taboo. There's just that sense of I need to not claim it. If I don't claim it, it won't happen. But it's not true. It runs in families. It's genetic. It's very genetic. It's multifactorial, as Dr. Kelly said. And if we don't admit it, we can't treat it. If we don't admit it, we can't actually talk about it as a community and solve it. And it's all of that that's led to some of what we're seeing here, which is some people don't know they're diabetic. So I saw a couple reports from one hospital in Michigan, where they said the patient said she didn't have diabetes. But then when they did her blood sugars, they were so high, and her A1C. So why is A1C important? Dr. Kelly talked about it, and it gives us a 3-month snapshot. So it means even if you've been dieting really well for the last week and your blood sugars are well controlled, when we draw your A1C, we can tell if you've really been doing so good for the last week or for the last 3 months. I don't know about you, Dr. Kelly, but I have patients who literally eat well the week before they come to me.
Yeah, that's why I love the A1C. Or they say, you know what, I didn't fast today, so you can't do my A1C. And I say, the A1C doesn't look at at what you did today. But back to your point about the taboo, I think some patients think diabetes is a death sentence. Yeah. And I just want to impress upon your audience that it's really not. Like, I have a really cute story. I had a patient who was, I believe, she was probably 84 or 85, came to me with diabetes, and her A1C was close to 10%.
My goodness. When
your A1C is that high, as a physician, I have to tell you that you need to go on insulin.
Yes.
Even though I know you're going to tell me no, at 10%, you really need to go on insulin. And she said to me, Doc, I am 80 something. I refuse to go on insulin. So I said, okay. I said, well, you're going to have to make some changes with your diet. And we talked about, what she should and shouldn't be eating. She said, well, I can give up everything, but can you at least allow me to have a slice of cornbread every week?
Yes.
So I said, okay, you're 84 at this age, you deserve to have a slice of cornbread,
right? Yes.
But she went home and she did so well that when she came back to see me 3 months later, she was actually having low blood sugars. Yes. And I had to take her off of medication. Yes. So I'm saying all this to say that when your doctor puts you on medication, even on insulin, if you do the right things early in your disease process, there is a chance that you can even get, if you have type 2 diabetes, you can even get off of insulin. We're not committing you to being on these medications for the rest of your life, but that is entirely up to you. If you never make the lifestyle changes, you will probably start off on one tablet. And then after a year or two, you're going to add a second one, a third one, a fourth one, until we get to insulin. But if you really make those lifestyle changes early on, before there's been any damage to your kidneys or to your heart, you can actually get off of medicines. People do it every single day.
Absolutely. And we have from Oki here saying, it's either Oki or okay. And it says, please speak about the unhealthy foods being masqueraded as healthy, like flavored yogurt, which has a lot of sugar, like the small Yoplait. Okay, we didn't mean to say the brand, which has like 9 teaspoons of sugar.
Yeah, I in terms of like snacks, I tell my patients, try to avoid things like potato chips or crackers, pretzels, but I say choose foods that are high in protein, high in fats, like some peanuts. If you like peanuts, have a reasonable serving of peanuts, because nuts are also high calorie food, so you can gain weight with that. But I like yogurt. Yogurt also high in protein, high in good fats, but you still have to be careful. We add sugar to so many things because sugar makes us feel good. If we feel good, we're going to continue to buy their product, right? Yeah. So they do these things so they keep us buying this back.
Sugar is addictive. Sugar is associated with, when you have what we call a sugar high, you do have endorphins, which are a hormone. It's the happy hormone. Endorphins spike when you eat sugar. So it's true. Yes, sugar is associated with happy feelings. Also, they tend to be associated with happy memories. Right. And, last week I got all sciencey and talked about the hippocampus and the amygdala, which is the memory part of our brain that's associated with memory. But it's because the memory part of your brain, it's associated with not just bad memories, but especially fond memories. And so for a lot of us, our fond memories are associated with sugar-rich foods, cake, right? I haven't really ever had cake at a sad moment. And so if I'm feeling sad and I want to feel happy, I'm probably going to seek out cake. So now cake and sugar are my happy memories, and a lot of the foods we ate as kids, it happens. Dr. Kelly, speaking of that, people have actually looked at the blood vessels of children and other markers of heart disease and diabetic damage early on in children, and seeing that you're seeing some of what you see in adults already in kids nowadays.
Yes, certainly. I think we need to really work on our families and trying to change some of the things that we do as families. I want to see parents take their children out to exercise rather than have them, on the phone or watching something on television. Like, kids need to run around and need to exercise. It baffles my mind because I'm not a parent, so maybe that's why it baffles me. But like, parents have control over what they feed their children, at least when they're at home. Yeah. So as a family, it becomes a family affair. When someone has diabetes, even as an adult, you need your family for support, because diabetes affects all of your life. That's the honest truth. So even like with Thanksgiving and Christmas last year, you probably can't eat everything that your family eats. So you really need your family to support you in terms of making sure that you have, if you're a man or your wife is a person who cooks, that you have healthy options, So it all starts with the family unit, and we need to get some new traditions.
Yes. as someone who treats teenagers who have insulin resistance and polycystic ovary syndrome, that's one of the key parts of my visits is I don't just have the teenager come in, I ask as many members of the family to come in so that we can talk about healthy options, because it's not good enough for the parents to tell me, doc, usually it's a female, right? She's not listening to what you told her. Doc, she's still eating her brother's Frosted Flakes. She's still eating her brother's Oreos. And I think, the reason why I bring in the family unit is because just like Dr. Kelly said, you have to realize that diabetes is what we call a lifestyle disease, type 2 diabetes in particular, because a lot of it is related to lifestyle in what you eat, lifestyle in your activities, lifestyle in whether you are sedentary, lifestyle in how you approach food. And so I bring in the family because I especially want them to understand that the child or the teenager's PCOS, insulin resistance isn't just the child's problem. So it's not just, let me tell on the child. It's also about what you, the parent, start doing about the family unit, what you eat, what's on the dinner table. It's not enough to tell her don't eat Frosted Flakes if her siblings are sitting at the table eating Frosted Flakes for breakfast. Seriously, she's not going to sit and eat oat bran if they're eating. So it's about finding fun ways so that everybody changes their diet. It's also because oftentimes the other siblings, if they're tested, are on their way also to being pre-diabetic. But in many families, the daughters are brought in because her periods are off. So that's how many girls get diagnosed with polycystic ovary syndrome in their teens, or she's growing hair on her face, or she has a lot of acne problems. For boys, people don't really realize that's going on with their sons in insulin resistance unless they also have weight issues and so forth. And so many times it's diagnosing the daughter that helps the family realize that they have something going on in the family. It's when some parents actually end up getting diagnosed themselves. I can't tell you how many mothers I have inadvertently diagnosed with polycystic ovary syndrome, etc., because I'm working up their daughter for it. And so it's important that we talk about all of this now, but also what we're really emphasizing, guys, again, like Dr. Kelly said, the family unit, okay? So if you're planning Thanksgiving dinner, grandma has diabetic, you heard cousin so-and-so just got diagnosed, cousin so-and-so also has sugar problems. Even if they love the food, maybe part of your way of showing them love is figuring out healthier options for your favorite recipes. Would you say so, Dr. Kelly?
Definitely.
And so it's important that we look at those sorts of things. Let's see. So Laura says, I am diabetic on both sides of my family. On my father's side, we have both types. I have also been told I have both types. Is that possible?
So
I think it's getting to the understanding now that some of type 2 has an autoimmune profile, right?
So before, like I said, it's mainly only type 1 or type 2, but there's kind of like a type 1.5. We call it LADA, latent autoimmune diabetes in adults. So in these patients, they also have the antibody.
LADA, correct? LADA.
LADA, LADA, latent A autoimmune, D diabetes in adults, LADA. So in LADA, these patients have the same antibodies that, say, a child or a teenager with type 1 has. However, they don't have such high titers or as many types of antibodies as a type 1 child. So their diabetes develops later in life. For those patients, because they do have the antibodies, I treat them as if they were type 1 diabetes. And it's important to distinguish between type 1 and type 2 diabetes, because if a type 1 diabetes does not get insulin, like if they run out of insulin, they could potentially become really sick and even die within a day or two because their body does not produce insulin. They go into something that's called diabetic ketoacidosis, otherwise known as DKA, where, remember I told you that insulin is needed for the sugar to go into the cells. So in DKA, there's not enough insulin, and there's a breakdown of a production of a product that's called ketones that makes your blood acid. And when your blood becomes acid, people have like nausea, vomiting, abdominal pain. It can affect how they breathe. Some of these patients end up on a ventilator. And even with the coronavirus, what I've been hearing from my colleagues who are in the hospital is that a lot of these patients are presenting with DKA.
Correct. And I think that's important. It's also why, although we didn't say it specifically, but you alluded to it, we tell diabetics, type 1, but all diabetics don't have a keto diet, right? Keto diet is not for you.
Especially type 1. And if you have type 1, you should also have something called ketone strips at home, so that if your blood sugars are over 240 milligram per deciliter for 2 times in a row, bless you, you can check your blood sugar, your blood urine for ketones for that acid. And if you do have ketones, you should probably call your you should call your primary care doctor or your endocrinologist to see if you need to go to the emergency room. When you start to have ketones in your blood and your urine, you need insulin via an IV. That's why you might need to go to the hospital. But a lot of the conditions like heart disease, DKA, strokes that were happening before coronavirus are still happening even during this coronavirus pandemic. And
we may have lost Dr. Kelly temporarily here. If so, she'll come back. She'll come back. I'm sure of it. She'll come back. But yes, like Dr. Kelly was saying, you have to be aware of this. And yes, there's LADA, which is this in between. I can tell you that I have, with confidence, told many of my family members they have LADA, which is type 2 diabetes that is highly insulin dependent. And some of it may be because of what we call pancreatic fatigue, which is your pancreas has been working so hard for so long, trying to manage your uncontrolled diabetes and your high blood sugars that it can't seem to get a handle on. That as a result, the pancreas is overwhelmed and it either doesn't make as much in the way of insulin or it can't keep up. And so for those patients, they especially need to be on insulin. Zelda says, read labels on packages. Absolutely, Zelda. My first thing that I try to encourage many people is try to reduce how many packaged foods you are reliant on, particularly even if you're healthy. If you have a family history of diabetes, high blood pressure, kidney failure, heart attack, stroke, any of those things in your family's history, obesity, you should definitely be reading labels, and more importantly, try to avoid as much packaged foods as possible. So that means if you are reading a label, the serving size really matters. Now, serving sizes have truly expanded. Dr. Kelly's back. And so it's important to understand that as well. But the big thing that we usually say is if you're going to eat any meal and carbohydrates are going to be on your plate, you shouldn't have more than a fistful of carbs on your plate. Right? Now, I know that sounds like the opposite of how we West Indians and Caribbean folk eat. Usually, all the plates is carbs, and then on top of the carbs, we put some meat on top of the carbs, not alongside the carbs. We put the meat on top of the carbs. And then usually in many Caribbean culture, if we have something called a salad, it's maybe 1 or 2 slices of tomatoes and cucumber. That's what at least that's what I grew up knowing was a salad. It wasn't until I moved to the United States and realized a salad was mostly vegetables with some protein and maybe a little carb. And so it's all about how you also retrain yourself to understand what should be on your plate and understanding that you need some carbs in your life. Absolutely. We're not here to tell you no carbs, but we're here to explain the type of carbs matter. Dr. Kelly, explain more. Like you said, avoid the white carbs. What does that mean and why?
So looking at labels is important. Someone put that, I saw that comment recently because some people tell me, I got sugar-free ice cream and I got sugar-free stuff. If you look at the back of the label, you would be able to see total carbohydrates, and they break it down into sugars and fiber. So make sure you look at the total carbohydrates, just not the sugar. But when it comes to say comparing white bread with brown bread, or wheat bread, the wheat bread has a lot more fiber in it. Mm-hmm. When you have fiber, you delay the digestion of the food in your stomach. So the absorption of sugar is, rather than a big spike like this, it's a more steady release of the sugar in the bloodstream. So I always tell my patients, if you want to have potato, have maybe the sweet potatoes instead of the white potato. You can have wheat bread. You can have brown rice instead of the white rice, or even whole wheat pasta. I have not had normal pasta in years. I only eat whole wheat pasta. Quinoa is another good food.
I feel like we're at this point.
I'm sorry?
Normal pasta, I would think it's weird at this point.
Yeah, your butt. People say, "Ew, that doesn't taste good," but after a while, your taste buds kind of get used to it. And I even tried lentil pasta recently.
Yeah,
chickpea pasta. So
yeah.
you play around with it. If you have diabetes, they probably have a lot more protein than just normal,
They
pasta.
do, especially the lentil ones.
Mhm.
As somebody who's mostly vegan, I say mostly because I dabble every now and then outside of the vegan scope. But as a mostly vegan person, I know it can be challenging as a mostly vegan person because most of what comprises a vegan or vegetarian diet is carb rich.
Yes.
And so that's when it becomes important to know what Dr. Kelly's talking about, which is their healthy carbs, which are the complex carbs versus the simple sugar. And, one of the big things that I noticed when I transitioned mostly from eating white bread to whole grain and brown bread, and the same goes for most of the complex carbs, is you also don't feel hungry as fast or as quickly as you do with the simple sugars or the white bread and the white pasta. That's the other thing that drives a lot of your overwhelming of your pancreas is you feel hungry so quickly after you've eaten these, like the white bread and so forth. Within a couple hours after your insulin spikes and the sugar is absorbed, you're hungry again. Your brain's like, feed me. And so it's important to go ahead and start that transition. So yes, eating all those things. Honestly, the pasta, whole wheat pasta, to me, it tastes more flavorful.
It does. I can't go back.
Yeah, I can't go back. To me now, the white pasta is very bland and flavorless. Carol says, hi, I'm diabetic, and it's true. Sometimes I feel for sugar or have the cravings for sugar products. I'll let Dr. Kelly answer this too, but what I've noticed many times when you're craving, that's when your sugar is actually really high, and it's a sign that your cells aren't seeing sugar. So your brain is like, oh, we're starving. Because believe it or not, if you're not getting the right insulin or sugars into your cells, your brain is starving in terms of how it interprets the message, even though there's lots of sugar in your bloodstream.
Agreed.
Zelda's practice associating happy memories with family gatherings and love, not with food.
It's true, but as we celebrate around food, birthday parties, weddings. My brother and his wife were having a baby, and they sent me a video of their shower. And I was at the good old days when we could have a party,
Yes.
But we celebrate around food, so it's hard to separate. But I agree with you. To get those happy thoughts, don't turn to a piece of cake. Or nowadays, people are drinking a glass of wine at 2 p.m. because we're all home. Those aren't good ways to deal with what we're going through.
And that's true because we didn't talk about it, but alcohol is one of the things that your body breaks down into sugar, empty calories. And so if you're a diabetic, that can have multiple impacts. Plus, alcohol can damage your liver. So that's a whole different conversation as well, but also related to how sugar is built and broken down. Your liver plays a role in that.
And then also we add lots of sugary stuff to our drinks, our cocktails. The rum punch that we have in the Caribbean, it's not just rum, it's the juices that are going to be
sweet,
really high.
But it's sweet. Pina colada, another sweet one. Daiquiris, sweet. Frozen margaritas, sweet. Yes, you're right. So Toby says, can we discuss PCOS and metformin and fertility? Well, I think the simplest thing I would tell you, Toby, is that metformin doesn't treat fertility. And we've established this in multiple studies. And I know a lot of primary care doctors and a lot of people who don't quite understand how metformin works. That's the first thing they prescribe to someone who has PCOS, insulin resistance. They give them metformin. Now, you need metformin if you have insulin resistance with your PCOS. Absolutely, because it helps you process sugar better. And if you process sugar better, your body is less likely to want to hold on to its weight. It'll allow you to lose weight if you exercise, which then has a direct impact on ovulation. Bottom line is this. We'll do a separate talk about PCOS. I'll bring Dr. Kelly back for that. We'll do a roundtable on PCOS because PCOS is an hour in and of itself that needs to be understood, because a lot of women who are diabetic in their 40s and 50s were PCOS when they were younger. PCOS definitely has a genetic part to it. So if your mom had PCOS, you're probably going to have it too. So we need to talk about that. But the bottom line is this: if you're PCOS with insulin resistance, metformin plays a role. The downstream effects of better sugar control, the weight loss that can come from it, leads to ovulation. And so that's why some people have started thinking metformin is a fertility drug, but it's not. And we prove it in the patients who are PCOS, skinny, and have to be on metformin. It's usually not enough for them to ovulate. Beverly says, very informative program, docs. Thank you, Beverly. Sasha, thank you. Zelda, become a family who does not buy frosted flakes. It's hard, I know. You know, my one thing as I started preparing for my isolation was I went out and I bought a box of frosted flakes because it was the only cereal I was willing to eat that was remaining on the shelf. But you're right, Zelda. You are right. Oki says, yep, that's why I started to drink my scotch and vodka straight. Okay, we're going to have to talk about this. Because we in the Caribbean like to chase with juice, in particular packaged juice. Yes. Honestly, in the Caribbean, if you can get real coconut water, like get a coconut, that might be a better chaser for you if you must have your cocktail with something in it. Michael says, I read somewhere. You know, Michael, I never like when people start off with I read somewhere. But let's see what you're saying here. That the only carbs diabetics should eat are sweet potatoes and legumes. How true is that? And that okra, spinach, bok choy, and kariley, bitter melon, actually bring down blood sugar. I don't know if you were here at the beginning, Michael, but Dr. Kelly and I talked a little bit about the okra part. But do you know what kariley is, bitter melon?
Nope.
So kariley is another one. People have studied kariley, and it can bring blood sugar down again 5 to 10 points, right? But if you're someone with true diabetes, A1C over 6.5, I'll be honest with you, kariley and okra daily is still not going to be enough to prevent the damage that's going to happen to your heart, your kidneys, etc. in the long term. Now, can you eat those? Diet, exercise, and use your medicines if needed? Absolutely. And that's the goal I want people to take away from today, if at all anything, is that it takes multiple steps to control blood sugars if you're diabetic. It takes multiple steps to help control your blood pressure as well. It's not just the one ingredient. And a lot of things can bring down blood sugar. It doesn't mean it's permanent. It doesn't mean it's lasting. It doesn't mean it's enough of a drop. Okay? It doesn't mean it's enough. So I'm not here to say no to okra. I'm not here to say no to sweet potatoes. Not here to say no to legumes. At the same time, you still want to eat your sweet potatoes in moderation. So remember that fistful, right? It doesn't mean you can now eat 4 sweet potatoes for lunch because the doctor told you that's what you should eat. High in sugar content, yes. And you know, there's even something known as a glycemic index. That's a whole other set of science that we need to talk to at some point. But we'll bring Dr. Kelly back because, you know, we want her to enjoy Easter Sunday. Merlene says, I may have missed it, but did anyone ask about recent discussion on metformin as a carcinogen?
So this came, was it November or December of last year? I think in Singapore, they found that the metformin made in Singapore was contaminated by a substance that led to cancer. So during that time, a lot of us got phone calls from patients saying, will metformin cause cancer? And the answer is no. The FDA looked at the sources that we get here in the States of metformin, and there was no contamination. And some studies actually show that metformin can actually fight against cancer.
Correct.
So what they were looking at was a contamination in the process and the plant of making metformin.
Yes.
So no, please stay on your metformin.
Correct. And if you're outside of the United States or you purchase your metformin outside of the United States for cost reasons, then that might be the question you do need to ask yourself is, what is the source of my metformin? But note what we're saying. It's not the metformin. There was one particular factory where they ended up having a contaminant that was a carcinogen, meaning something that can cause cancer, but not metformin itself. Winston says, one question. I heard someone say that whiskey is good for diabetics. I don't believe that, but can you clear this up for me? Do you want to take?
I looked it up, and apparently whiskey has 0% sugar in it. So as you were saying before, sometimes the alcohol itself doesn't raise your blood sugars, but it's all of the chaser that we add to it. but still be careful with alcohol, because the liver makes sugar by a process called gluconeogenesis. It's a long name to mean it makes sugar. So if we, drink too much alcohol, sometimes it can reduce your body's ability to make sugar from the liver, and it can actually lead to low blood sugars.
Yes. It could also, if you end up being an alcoholic, you could kill your liver. So it can't build or break down sugar. And that's a whole other conversation. But many alcoholics can end up with liver disease that further predisposes them for sugar problems, because they all go together, guys. Kidneys work with liver, work with heart, work with heart. They work together. Joanne says, thanks, Dr. Duke and Dr. Kelly, for all the information. Much appreciated. I'm always learning something new. Joanne. And that, of course, is the goal here, is to learn something new. We're giving you information that's practical. Dr. Kelly also does her own live. Dr. Kelly, I'm going to have you tell them more about that, because Dr. Kelly is somebody you need to follow. She talks about practical ways to manage diabetes. She also tells you the amazing success stories that she's had with patients, including, because she's in Atlanta, she does have a large patient population that's African American, and she treats them and treats them well. She has amazing success stories like the one she shared with her 80-plus-year-old patient.
Mm-hmm.
Winston says, can you explain why complex carbohydrates are better than simple carbohydrates? How does fiber affect sugar absorption? Well, guys, we're doing a good job if Winston came in.
Thank you, Winston, for coming in.
You have questions too.
So I think we kind of talked about it before. The complex carbohydrates have a higher fiber content, and the more fiber you have, the slower your stomach will digest the sugars. So instead of having a spike of sugar with, like, say, white bread or white potatoes, when you have fiber, it's a more slow release of the sugar into your bloodstream.
Mm-hmm. It's also why we recommend it actually having, well, I shouldn't say we, but I'll see if Dr. Kelly agrees with me. I know when I talk to my patients, I tell them their carb loading, if you're going to eat carbs, it should be at the start of your day for sure. Complex carbs, yes. But it's also so that you start the day off breaking the fast that your brain was in for sleeping. Because that's the reason why the word break fast actually has scientific meaning. You're breaking the fast, but also it stops your brain from thinking it's not going to eat today, because it's going to have a nice, slow, steady release of sugar and energy. And so, one, you're not craving all day, you're not fighting it, but it also just helps you manage your sugar better. Do you have anything to add, Dr. Kelly?
Oh, no, I agree with you.
Okay. Nadine says I came on late. Nadine, there will be a replay here on Facebook, Twitter, Periscope. For those who are watching, I'm Dr. Cindy. I'm a reproductive endocrine and infertility specialist based in Las Vegas, Nevada. I'm also a virologist, and so we're talking about COVID-19 today, but specifically about diabetes and managing diabetes in the time of COVID-19. And my guest is Dr. Kelly Wood, medical doctor. She is internal medicine board certified and board certified medical endocrinologist, meaning she's also a diabetologist. She manages thyroid, you name the hormone, she manages it in all patients. Michael says, thank you so much. Let's see who else. Ooh, we have so many here. Let's see how many more we can get. Dr. Kelly and I would hopefully sign off in 8 minutes, but we'll try to get to Baron says, can being on a fruit diet increase your blood sugar level? And this would include, I guess, the most common fruit diet I see on social media is the Daniel fast, which is you mostly eat fruit for 12 to 21 days.
So you still have to be careful with fruit if you have diabetes. Fruit contains natural sugars called sucrose, which are broken down into, into sugar.
And glucose.
Yes.
Yeah.
So you still need to be careful with sugars. A lot of my patients love the things that they shouldn't have, like grapes and bananas and, the melon families. Those things you can still have, but have in moderation. When I see a new patient with diabetes, like I said, I'm a realistic doctor. So I don't expect you to just, in 1 hour, I can change your whole thinking and you're going to cut all of your carbs out. But one thing that I say you need to cut out, no questions asked, is soda and juices.
Yes.
A lot of times we might have a bottle of soda and we're consuming 240 calories in like a bottle of Coke. Yes. And God knows
40 grams of sugar, right?
40 grams of sugar, exactly.
Coca-Cola, one 12-ounce Coca-Cola has 40 grams of sugar, guys. 40 grams. That's multiple teaspoons of sugar.
And then even like having orange juice, to get 8 ounces of orange juice, you probably have to squeeze, I don't know, what, 10 oranges to get 8 ounces of orange juice?
The size.
I'm sorry? Depending on the size.
Depending on the size of the orange.
So one thing to cut out from the get-go is no juices, no soda. You should still have some juice in your house in case your blood sugar goes low and you need to treat a low blood sugar. But besides that, you should not be having, as a diabetic, having any kind of fruit juice.
Yes.
Just my opinion, though.
Agreed. No, and that's important, you know, and if you're going to have fruit juice, then you're going to have to juice it yourself. But really, the packaged juices, they have so many things in them. They have added sugar. They have added sugar. Whether we like it or not, sugar is added to most packaged foods, whether it's the form of sugar itself, a syrup of some kind, sugar is in there, okay? Even when they say sugar-free, it's got something that breaks down to sugar or acts like sugar in your body. And so we need to know about that. More questions here. Thank you both so much. Love you all. Thank you, Yvette. Catherine says, by the way, I appreciate the knowledge you all are sharing. Thank you, Catherine. We appreciate you. Lynette says, we need Atlanta contact. So Dr. Kelly, that's you. How can they find you if someone's listening right now and their family members are in Atlanta and they're thinking, you know what, this is the doctor for them? How do they find you?
So you can find me all on social media at Dr. Kelly Wood, MD, and I'll spell it for you. It's DrKellyWoodMD. I love to speak with you. Please follow my page. Like Dr. Cindy, I've been doing Facebook Lives on coronavirus and diabetes and if you should wear a mask or not. Thank you, Dr. Cindy. So yeah, send me a message. I'll be sure to respond to you.
Yes. And you are seeing patients via telemedicine as well at this time?
So, yes.
Right.
I work in Fayetteville, Georgia, Piedmont Fayette. So we are still seeing, even now, we're still seeing patients by either video conferencing or telephone calls.
Wonderful. And is keto diet great for diabetics? Nikki, I would highly encourage you to go back and watch the video, but the short answer was no, it's not great for diabetics. Correct, doctor?
Yes, I agree.
And
especially not for type 1 diabetics.
Especially not for type 1. Here we have good. Okay, it's appearing on all media, your information. I love it. Some juices say no sugar, but they're high in sugar.
Like I said, you have to be careful when you look at the back of the label. If they talk about total carbohydrates versus sugar versus fibers, look at the total carbohydrates. And there's no such thing as sugar-free ice cream is still going to have some carbs in it.
Yes.
Sugar-free cookies, they're still going to have some kind of carbs in it. Yeah. So please look at the back of your label.
And I think that's the thing for people to understand, right? Let's talk about hidden sugars, because I think most people think sugar is only when you hear the word sugar. So what things break down into sugar? Like Dr. Kelly said, fruit has sucrose, which is fructose and glucose, two simple sugars together. Milk has galactose, which is a sugar. So when you read the word lactose, lactose is actually a milk sugar, but it breaks down into other sugars. Everything you eat, your provisions, our gram provisions, our plantains, our bananas, our rice, our pasta. Oh my God, what else, Dr. Kelly? All these things actually break down into sugar in our body, right? Yuca, cassava, dashin or taro. So of course, we also see that in communities around the world, globally, where these foods are key components of their diet, diabetes is present. So we see diabetes in not just people of African heritage, we see it in people of Southeast Asian heritage, high rates of diabetes. We see it amongst people of Native American heritage, because there's a lot of corn and other things that break down into sugar in their diet as well. We see it in people of Polynesian heritage, where there's also a lot of rice and taro or poi as well, and plantains, bananas, etc. So there's a lot of hidden sugar, even when you don't know about it. And again, we're not here to tell you this to scare you so you stop eating. We want you to eat in moderation, be aware, so that if you're diabetic and you're trying to figure out what's safe to eat or not, you now understand it's not just the things that have the word sugar on them. Right, Dr. Kelly?
Yes.
Okay.
I'm looking for your other questions to pop up.
Oh, okay, sorry. Yes. So other questions that we have here, Merlene says, is partial fasting helpful to diabetics? So I imagine she's asking about intermittent
fasting. So I I've read some health benefits like reducing inflammatory markers and stuff like that with intermittent fasting. Whatever you do, please speak to your doctor before you go on any diet, because for example, if you're taking insulin, we would have to tailor your insulin regimen according to your fasting schedule. Some of the medicines that you take for diabetes have longer half-life. So if you do fast, you might have a low blood sugar. So before you start any diet, like intermittent fasting or even paleo diet or whole 30, like please consult your physician, because your medicines might need to be adjusted.
Yeah, it's really important to do that, right? I know I've had a patient sit before me. She was well-meaning. She had type 2 diabetes, not very well controlled, started with an A1C of 13, but she was determined to get pregnant. So we had talked about things and she said, okay, Dr. Duke, I'm going to take it in my hands. She then went and she saw a chiropractor who also had a weight loss program going. And she stopped all her medicines, went on intermittent fasting. And needless to say, it landed her in the hospital, because she didn't need to stop all her medicines. It wasn't healthy to do. And had she consulted with myself, with her diabetic teaching coach, her nutritionist, we would have worked with her and that physical therapist, chiropractor, who was going to be working with her. But you really need to talk to your specialist, okay? And that's the important thing that I want to emphasize here, like Dr. Kelly's emphasizing. We're not here because we're telling you don't do things. And so if you decide to do it, you have to hide from us. We don't want you hiding. We want you telling us. We get it. We know. We told you. We know there's taboo. We know there's taboo. So we understand that taboo is going to drive you to try to not have to be on medications. It's going to drive you to not have to watch your diet as carefully, maybe. But what we don't want you to do is have taboo drive you to your premature death. And we want you to talk to us because we listen and we will work with you. Your doctor will work with you.
There's a train of thought that doctors just want to push medication on you, and that's not true. I am the happiest person. Like Dr. Cindy, she sees my posts on social media when I get a patient off of insulin. Like, if you're happy, I'm very happy for you too, once you get off of medication. So if you go on a diet, we will work with you to try and adjust your medications as you progress. We're not just pushing medication on you. And, diabetes really affects your entire life. It affects, how you eat. You're having to check your blood sugar before eating, having to give insulin with your meals. And I can imagine how overwhelming that is for an individual, but it's not a death sentence.
Oh.
If you take good care of your diabetes, especially early on, you can reverse it. You can go into remission.
Yes, you really can, guys. And it's important to know this, but putting your head in the sand and saying, the doctor told me I have diabetes, but I'm not claiming that, doesn't stop your kidneys from getting damaged in the long run. And it doesn't stop your heart from getting hurt. Literally, it doesn't stop it. So we want you to know that. Question here for you, Dr. Kelly. How about homemade lemonade?
Are you putting sugar in your lemonade, Ian? We can talk a little bit about artificial sweeteners. The one that I like is called stevia. Yeah. There's so many of them out there. Try to avoid sugary drinks. So if you are putting sugar in your lemonade, it's still as bad as buying store-made lemonade.
Yes. The only difference between homemade and store-made is you may control how much sugar is in there and you may avoid other processed additives, but yes, it's still sugar. If honestly you have a cup of homemade lemonade at the family barbecue once a year, we're not going to tell you no.
No, that's okay.
Yeah, it's okay. But if you're someone who needs a cup of homemade lemonade with every meal or every dinner, that's a problem. That's a problem. Artificial sweeteners, I personally counsel people to avoid them only because it still leads your brain to crave
sugar. Mm-hmm.
Yes. And so if you then don't have the artificial sweetener around, you're going to look for real sweetener because you still need to taste that extreme sweetness, because a lot of the sweeteners, they're all just extremely sweet, albeit stevia is derived from a plant. So it's not manufactured in a lab, so to speak, in the same way that the others are, but it's still made in a lab and packaged in a lab. Moderation is key. This is from Nadine. Do you want to say any more here, Dr. Kelly?
Thank you. No, thank you for having me. This was really, your audience is very engaging. I really love it.
Very engaging. They love the info and they ask, and some of these I'm asking because they send these questions to me. So Catherine is asking, how about agave, which is a syrup derived from that plant that actually makes tequila?
I think agave still has a high sugar content, right?
Agave still has high sugar, but it's a natural sugar. Same goes for honey. Again, what we're saying to people is about moderation here. If you need to make a glass of lemonade once a year or so, or a pitcher of lemonade, and your syrup of choice is agave, we're not going to stop you. But if this is what you're making every day, thinking it's not sugar, you're not helping yourself. You're actually fooling yourself. Same way if you're using coconut sugar. And I speak as someone who's used all these. So if I bake and absolutely need some sugar, I use coconut sugar nowadays. But I don't bake much. I'm not going to lie.
Right.
Cindy doesn't bake much, and she doesn't eat that many baked goods, except when she's around her mom, who's a diabetic. And I've worked very hard to teach my mom about good ingredients for herself.
It's a lifestyle, it's a lifestyle change that you have to make, and it's gradual. And we were people too. We have families. We get that you're not going to just switch off a switch and turn off a switch and then, eat perfectly. We get it.
Yes. Now, Dr. Kelly, I don't have a question here, but it's a statement I've seen from quite a few patients that I've treated in the Caribbean, particularly in Trinidad and Tobago. And it's either based in truth or it's based in interpreted truth from the patient, which is they keep saying, I've met a lot of patients with really poorly controlled diabetes who, when I say, you know what, you're going to need insulin, they say, no. The other doctor told me the one thing I never want to do is get on insulin. What do you think?
I've heard that before, and I think it's because people think that once you go on insulin, you will never come off. And so diabetes is a progressive disease. Like I said earlier, you kind of start off, usually we start off with a medication called metformin, one of the oldest drugs we have available to treat diabetes. If you don't get your blood sugars under control, the high blood sugars become toxic to the pancreas itself, which makes less insulin, which leads to even higher blood sugars. So after a few years, people end up on one tablet, 2, 3, 4, until we've exhausted all of our options with tablets, then they end up on insulin. However, there's some patients when they first present with diabetes, their blood sugars are extremely high. And to allow the pancreas to recover, we have to give them insulin to break that cycle of high blood sugars, damage the pancreas, less insulin, high blood sugars. So insulin kind of breaks that cycle. And I've seen so many patients who I tell them, your A1C is 10 or 11%, your pancreas is sick right now, I have to give it some insulin. If you make the lifestyle changes, you will get off of this. And I have seen patients come off, a lot of them. So insulin does not have to be permanent, but that decision is up to you.
Yes, and that's exactly it. It's up to you. It's not up to the doctor. It's not up to your pastor. It's not up to the faith healer. It's not up to that person. It's up to you. It's up to how do you change your diet? How do you change your activities? How do you change your mindset as you approach your illness as well? And, instead of not claiming it, claim it and then address it. Let's do that. Now, Dr. Kelly, I thank you so much for your time today. I know the audience thanks you as well. And oh my gosh, more questions are coming in. But while those come in, maybe we'll show some of them. But tell me, Dr. Kelly, you already told people how to find you in Fayetteville for seeing you as a doctor. But Dr. Kelly, you're so much more than a diabetologist, medical endocrinologist. Tell the audience more about who Kelly Wood, MD, is in the media and in the world of women and empowerment, etc.
So first and foremost, I'm Bajan. Will always be a Bajan. But in addition to medicine, my other passion is helping women. So I help high performing women overcome past hurt to have a happy, healthy relationship. And I actually have a best-selling book. You guys can't see it. The light is kind of bright, but it's called Bounce Back to a Better You, Recovering from the Disappointment of a Failed Relationship. And if you guys want to get a copy of this book, this will teach you how to bounce back from a failed relationship, from a broken relationship. And even now during this pandemic, we all need to bounce back. So the concepts in this book will be helpful for anyone. You can find this book at www.drkellysbook.com, DERKELLYS book.com. It's also on Amazon, but if you want an autographed copy, you got to go to my site for the book.
Yes. And Dr. Kelly, in terms of working with women, you've done so many amazing things working with women and teaching them how to bounce back even in terms of health, because broken relationships can impact someone's health and diabetes and high blood pressure, right?
Yes, if I can share my story a little bit. So I actually moved to Atlanta 3 years ago because I was getting engaged to someone who lived here, and that ended a couple months after I got here. So here I was, new city, no friends, no family, not even a job. I had to find a job after that. And I literally had to put my life back together. But in terms of the health piece of it, like I gained a lot of weight. My face broke out. I had acne. I'm the one who has psoriasis. My psoriasis went out of control. I wasn't sleeping. So, high levels of cortisol. So obviously I wouldn't have been able to, another hormone. I wouldn't have been able to lose weight during that time. So, we are just not physical people. We are also emotional beings, spiritual beings, and it all kind of affects one another. So if you want to be healthy, you have to be healthy, not only in body, but in mind and spirit. And one last thing I want to say, with the coronavirus pandemic, we kind of talked about the physical aspect, but I know so many people who are having worsening anxiety and worsening depression because of the isolation and the social distancing. And there's some things that you can do to protect your mental health. Like, don't have on the TV for the entire day. Don't be on Facebook for the entire day. Even though you are social distancing, still check in with your family, use video, use Skype, whatever you need to use to stay connected. Pray, meditate, keep yourself grounded, because we will come out of this. We will come out of this.
It's true. There are a couple here that I think we should address. So I'm labeled a type 2 diabetic, but I'm not claiming it because I've come to realize that my wounds do heal, unlike those with type 1. I also do have underlying issues as well. So how would you explain this medically? Do you want to tackle this, Dr. Kelly?
So they're saying that that they don't have an issue with wound healing?
It seems that way, and it seems like that is then how they've reassured themselves that they don't need to claim the type 2 diabetes. Yet it's also contradictory because they're saying they have underlying issues. So I'm not sure it's up to us, Nishi, to explain this medically, as it is up to you to finally reconcile and accept that you have a medical condition that needs to be addressed.
I always tell my patients, the reason why diabetes is called one of the silent killers is because it does not hurt until you have a complication. If somebody had pain when their blood sugar was 300, 400 milligrams per deciliter, they would probably take their insulin because it would hurt. That's why people ignore it, why people kind of rationalize that they're not claiming it or they don't have it until they have something like a stroke or a heart attack. I mean, I have stories for days. I had a patient who was a school teacher, and she had to stop teaching because she had mini strokes. Then she had a really big stroke where she could not remember. Our first visit, I asked her, "Where do you live?" And she could not tell me where she lived. So yes, having delayed wound healing is a complication of diabetes, but not all uncontrolled diabetics have delayed wound healing.
Right.
So God forbid, you might be having something else that you don't know yet until you have that stroke.
And you might be having internal wounds that aren't healing, that cause the other underlying conditions that you think aren't related. Like kidney disease, you may think it's separate, but it's related. You might find that you're having sexual dysfunction, think it's different, but it's related. You might also find that now your feet cramp a lot, or your legs, you're not really feeling everything in your toes the way you used to. They're all related. You might be having changes in your vision or dark spots, or your skin used to look really healthy, really pretty, used to have a glow, and it's changed. You can actually have dermatologic changes in diabetes. We talked about acanthosis nigricans, which is that darkness around the neck. But some people's acanthosis spreads. It's between their thighs, between the thighs, really dark. Under the armpit gets really dark. They have those spots on the face, which the word melasma. You can see melasma as part of uncontrolled diabetes, hypertension. It's not just related to only pregnancy, but it's related to a lot of other hormonal changes. Your skin can show it. So guys, there's a lot more to it. Dr. Ian Levine says, I'm Bajan too, 100%. Dr. Kelly's 110% Bajan. Yes. Dear Dr. Cindy and Dr. Kelly, thanks for your phenomenal knowledge and clear for humanity. Wishing you a successful week ahead. Regards, Dr. Ian Levine, Cayman Islands. Thanks, Dr. Ian. Dr. Kelly, it looks like we'll just ease up to the hour and we'll split this up. Thank you for taking the time. I think we answered everybody. So before we get more, Dr. Kelly, thank you.
Thank you for having me.
Happy Easter. I hope you get to spend some time with family, even if it's virtual.
I will. My family in Barbados, I haven't heard them today yet, so I'll be calling them on video.
Yes. And to everybody else who's watching, do please take care of yourself. If you have more questions for myself or Dr. Kelly, feel free to email them to info@drcindyduke.com, all one word, info@drcindyduke.com. Dr. Kelly is at drkellywood.com.
drkellywoodmd.com.
MD.com. And Dr. Kelly is on all social media. She'll also be available to answer questions in the comments, perhaps mostly on Facebook. But if there are emails, you send them, I'll send them to her, and we go from there. Until then, happy Sunday, happy Easter, happy Passover for those who are still celebrating Passover. See you tomorrow.